Welcome to Doodles Episode 12. I'm your host, Sapna Malhotra. As a kid, I remember I was scared of math. Every time I had to take a math test or an exam, I used to get nightmares. I would be on the edge till the result came out. I would slog, I would really work hard and somehow get by. But it was a totally different story when it came to sciences or languages. I loved them. I enjoyed them. And that got me thinking that what is it that some of us find certain things so easy and some things always remain very difficult. For some of us, learning a piece of music is a piece of cake. For some of us, creating a painting is as easy as that. For others, a math problem, a physics problem, or a science concept. Some things just come naturally to us. I think we are all very different. We have different skin color, hair color, eye color. And the main thing that is different is the way our brain functions. It is unique to us. It's unique like our fingerprint. The way we understand, interpret, and express things is so individual to us. And that uniqueness of our brain function manifests itself in our personality, in our tastes, in our likes, dislikes, in our strengths, and also in our weaknesses. And we all have our bunch of strengths and weaknesses. And sometimes those weaknesses become stronger than our strengths. Sometimes we need extra help and support to overcome those weaknesses and bring our strengths up. Today on Doodles, we have two amazing guests. They're experts in their fields, and we're going to talk a lot about how we can, bring up our strengths and overcome those difficulties or challenges that we face. Welcome to Doodles, Nayana and Dr. Vasudha.
Thank you. It's a pleasure to be here.
Same here. Such an delight to have both of you here. Dr. Vasudha is joining us from Chennai. Dr. Vasudha Prakash. She is the founder director of VXL Educational Trust there, which is an organization which has schools for special needs kids. And she's been a special educator for past 26 years now. And my second guest is Nayana Kharosekar, and she has been an educator for the past 10 years. She's a special educator for the past 5 years now. She's working with Bethany High School in Bangalore. Welcome to Doodles once again.
Thank you, Sapna. Thank you, Sapna.
So I come to you, Dr. Vasudha. Tell us a little bit about your journey, how you came about to be there where you are right now.
Okay. I'll be as brief as possible because I'm old enough to have a very long story.
Please go ahead.
I started my career as a clinical psychologist, and I used to work with children and adults alike in India. Then after I got married, I moved to Saudi Arabia. Saudi Arabia at that time was quite a restricted country, but I got to work in the Indian Embassy school, where I used to work with the primary grades and work with children who had some learning problems as well. So I think that was a seed was sown in Saudi Arabia. And I also liked early childhood education when I worked over there. Then from Saudi Arabia, we moved to the US. And the US, although I chose to be in the education field rather than the psychology field, and instead of psychology, I moved into educational management. But by some recommendations and after reading up, I moved to special education. I really don't know why that happened. I think there was a hand of destiny in the way that transition happened. And I got a doctorate in special education from Rutgers University. And that was a very illuminating journey because I got to visit so many schools over there. And I used to be a supervisor for interns. I had a big body of work right there. And I worked in one of the schools, urban schools, which is called Newark Public Schools. It was predominantly a lower income group, socio-economic class, and with a lot of African Americans, a lot of people with challenges, that exposed me to a lot of learning problems and environmental problems, which contributed to learning difficulties. And from there, worked as a professor, an assistant professor on the tenure track at Kane University. And while I was working there, anyway, I had, when you submit your statement of purpose, when you enroll for a PhD program, you have to write about what you want to do. And my statement of purpose, I had written that I'd like to come to India and work with in the education field over here. And and that's exactly what I did. I moved back to India. Now it's almost 20 years. Came to Chennai. Although I hail from Mumbai, my family had moved to Chennai by then. So I again feel that it was just destined to happen. Moved to Chennai and started with just about 11 children, Center for for cognitive disabilities and developmentally disabled, VXL Educational Trust, in a small
Right.
place in one of the areas here in Chennai. But within the year was out, we had 65 children, and by 3 years we had about 200 children. Like, it was just, the need was so great by that
Yeah.
time that many people, it just grew very organically and seamlessly. So
Right.
we started a school, but then we then started an early intervention, then a pre-vocational and a vocational, and we have a farm, we have an employment sector and a placement division, and now we have about 13, 14 schools actually,
Wow.
two of them in Maharashtra, with branches even in Sholapur, Nasik, and some here in the south in Tamil Nadu. And we
Right.
work with cognitive disabilities, and also physically challenged if they have cognitive disabilities. So
Right.
when you talk about that, we have autism, Asperger's syndrome, learning disabilities, attention deficit disorder, and so on. We also
Right.
work with inclusion. So this is how it all started, and
Yes,
now
in
we are
fact,
here.
your colleague Geeta was with us a few weeks back when we
Yeah,
had a talk about children on autism spectrum disorder. Yes, and
yes,
even
yeah.
Neha and Pooja were there. Then.
Puja, yeah, they are really the experts.
Yes. So coming to
Yeah.
you, Nana, how has your journey been?
So let me first thank you for having me on your show. And it's my absolute honor and pleasure to get to be on the same panel as Dr. Vasudha. So I am super thrilled. While
Great.
my story is also quite unique, when you say, I mean, how did I land up here?
Right.
So I was a hands-on mother, and I'm very proud that's the primary job. So for a good 15 years, and you know me, I mean, we were all together. So 15 years, I was completely a homemaker and a hands-on mother. But relocated a couple of times, and by chance, I got to work in Kumon in US, in Dallas, when I was there. And that was my first role on the other side. Okay,
Right.
so then I realized that it's something else to be on the other side, and as a mother and as a teacher. So my colleagues would give me of course I was not trained, I'm not trained to be a teacher then. So I mean, that's where people started telling me those small things, which I attribute my journey to those inputs which different people gave me at different times. So one thing led to the other, and I worked in an alternative school for very long, for 4 years, and that influence is very strong on me. And there I realized that I don't have the skills. Whatever I'm doing, I'm lacking. I need to do more. I need to do more. So that's how I went into the studying about special education, and one thing led to the other, and I make it a point that I continue my exploration on the sides. Okay, so that is what I really love. I mean, uh, teaching is just the front end of it. The back end part is so huge, and it just not, how much ever you do, it's not enough. So then again, by chance, got into Bethany. A friend of mine, again, I mean, many people have influenced, and where I land is, I mean, because of them. So last 5 years now, this is the fifth year with Bethany, and I mean, that's the story, and I'm very happy. So, as a special educator, I guess my degrees are in commerce. I intended to be a homemaker, but ended up being a special
Yeah.
educator. So, and I'm so glad for the journey.
And I'm so happy to have the both of you here because both your stories are so inspiring and so beautiful a journey for both of you. And like Vasudha, you also said, and you, Nana, also said that it was just destined for you to be where you are, and you seem so in such a happy place to be, right? So
Right.
let's jump into our conversation today, and I'm going to bring out the big question, like I always call it the big question, and that question is that is it a learning disorder or is it learning differently? What is that fine line that differentiates the two? What is it? I'll put that to you, Vasudha, first.
So, good question, because you said learning disability disorder, or is it a learning difference? So you didn't say learning difficulty, you said learning difference. So it says a lot. Now, they do, children who have, now today's topic being learning disabilities, uh, we have to understand that children with learning disabilities learn differently. Yes, definitely. But is it a disability? It is a disability in terms of what is the norm, and that many children are able to adapt to the kind of learning styles that are required of them in the regular school. And this group of children, they're not able to adapt to that particular learning style. In that manner, it is a disorder. Yeah, but if you can perceive that as a learning difference, then we don't have to advocate for inclusion quite as much. You see, so but have yes, that is one view. But if you go a little deeper and little technically, if this particular learning disability, which is a learning difference, has its roots even in the way the child is formed in early childhood. So you, even before pre-numeracy and pre-letter, pre-alphabet, all of that, you can see a little the individual differences or the invisible differences start showing up in the way they process their senses and their posture. So everything about a child is about the physical development, which just then goes into the neurological development. So the health of a child and the mental ability of a child are greatly intertwined. So so to answer a question, this learning difference in this learning disorder comes and happens in the way that the child is formed, even from birth right through till the child hits school, and then at school it manifests itself. So did I answer your question? And
Yes.
if I can also add a little bit, if I add that added parameter of learning difficulty versus learning disability, there also there's a huge difference. A learning difficulty is a bit of a broad framework. It's a broad definition in which a child who has a language issue or English as a second language, that child can have a learning difficulty. A child who has a physical problem, like he doesn't have some other developmental issue, he can have a learning difficulty. But a learning disability, which used to appropriately be called specific learning disability, it used to be called the previous DSM, it used to be called specific learning disability. That term is very appropriate because overall the child is intelligent, but the disability is about one specific area. So the difference between the garden variety, what they call learning difficulty versus learning disability, also has to be understood very clearly, not only by parents and of course teachers and other professionals in the education sector.
Right.
So.
Absolutely. Absolutely. How about you, Nana? What are your views on that?
Yeah, so pretty much I would continue from where Dr. Vasudha has said that these are all terms which have their own meanings. So if for a person, we take the meaning with the objective to work with the child. Okay, so I was told by Mrs. Krishnamurthy in Spastic Society of Karnataka that as a special educator, we will give you the terms and we will give you all the information for you to understand what it is. But as a special educator, your objective is to take it forward and work around those challenges and not use them as labels. So disorder and difficulty and difference, of absolutely they are different and they have their own meanings. But I would say, I mean, pretty much, I mean, Dr. Vasudha has elaborated very nicely and she comes with that background. But for a special educator, I feel it has to be used to create the learning environment around the child and support the child, equip the family also to take it forward from there, is
Correct.
what
And
I.
I somewhere what both of you are meaning to say is that, it's just a term used, but definitely whenever we talk about a child who is going through a learning disorder, that's one part of that child. There is a huge entire being which is there other than that small thing that is there, right?
Absolutely.
And all of us, like I was saying in the beginning also, that all of us have our own weaknesses and strengths, and we need to remember those, the other part of the
Absolutely.
strong part that is also there within that child. So
Right.
all of this, I want to ask you, Naina, now that you were talking about it, how easy or how difficult is it as a special educator that you're there now, and to identify that child, or to feel that that child needs a little more than some other child?
All right. So let me give you an idea of, again, what I really feel, I'm little deviating from the question, is how do I, as a special educator, identify comes in little later, but the first responders are the family members, and more so, I would say the mother as well as the grandmother will be able to identify. So developmental delays in early childhood are, are an indicator, and that's where it starts manifesting. Now coming to schools in the primary years, although there is no formal diagnosis recommended till 7 years now, correct me, Dr. Vasudha, if I'm wrong, but basically it is the general observation by the teacher, and it is also correlated with the observation at home, and that's where it is started to notice, and then probably it leads to formal diagnosis, and then it is taken forward from there. So as a when the child comes in middle school, or probably is eighth grade, it's the diagnosis is already done, and we are on the path for remedials also. So that's how, the important years would be observation purposes, primary school, interacting with the doctors and other experts, sixth, seventh, and then onwards it's remediation and other support given to the child.
So I wanted to ask Dr. Vasudha, so how early on can you start,
Becoming
detecting?
aware.
Yes, yes, those symptoms. Of course, when they're babies, like you said, that very early on you can kind of know little bit those signs are there. But what signs can parents or the family or the teachers can look at and feel that yes, definitely now that is where the child needs a little more support?
So that word definitely we may not be able to substantiate, but then the four lower senses give you some indicators about whether the child is making a certain, you have to go watch a little deeper or not. Okay, once a child walks, even before that, we have to watch the milestones. Is the child moving seamlessly from one milestone to the other? That's very important. Okay, sometimes even the crawling, creeping is done differently by different children. There are sometimes parents tell you that, oh, my child is very fast. He skipped the crawling and went directly to sitting or went directly to standing. Well, that is not necessarily ideal, because the way a child crawls, some children move on their bums. Some children, just roll. Even those can be small indicators of uh, early childhood, slightly symptomatic, not definite, but then you can have your antennas up like that. And also you can encourage the children to go through those milestones in a normal fashion. That is, the child is only rolling, try to not push, but nudge the child towards using his force and so on, because those are the very foundational things for the neurological framework. Now, when the child is a little older, I'm going to read off this thing. Does the child move in an ungainly fashion? That's one indicator. Please wait. I'll just move the screen a little if I can. No, I'm not able to. That's fine. So is a child moving in an ungainly fashion? Does he appear reluctant to try new activities? Does he crash into things? And is his energy level too much or too little? Do you have to repeat instructions? Then suppose he's doing something, does he quickly forget and then quickly move on to the other things? Or how much time on task is he displaying? And no urgency. After the child grows a little older, however much you prod the child to go to the next thing, there's no sense of urgency. Concentration is less. And after speech comes, is he taking little longer for clarity of speech? So these are things you can watch out for. And the other things also are how long, fiddling too much with buttons, and whether they're allowing them to be hugged. Are they coordinated? Are they able to understand the rules of any game? So these are waiting tolerance, sitting tolerance, all these things you can observe a little. And though there is a developmental range, you can't say, okay, exactly at this time the milestone will happen. But if it exceeds a certain time frame, for example, if something has to be done at 1 year, 1.3 is okay. But 1.6, you may want to see what is going on. So in early years, the development is clustered closer, like percentile ranks, like that, it is a little closer. So every month, every week actually makes a difference. So these are some early signs. And also with movement is very important. And then sense of balance. These two things you have to observe. How are the senses functioning? How are the postural symptoms happening for the child at every stage? These are two very important things. And balance, these are very important. And a couple of other things, I don't know, also this hearing and all that, the inner ear development, how is the body geography, gravity of the body versus the body, the surroundings. And I have a list of things you have to look out for, and that can come later in your during our discussion. So did I answer your question? But the actual identifying and categorizing and diagnosing can happen only after the age of 6.5, and the child shows difficulty in sequencing even letters. The child is not able to say A, B, C, D, F, G, or in a sequence. These are small indicators. So that diagnosis can happen only after the age of 7, like Nayana said. So you can't label. Till then, you keep doing pre-referral intervention. A lot of activities, group activities, games, stepping games, rhythm games, all of those things, painting, art. Yeah. Then these are pre-referral interventions. Yeah.
And I think when I was putting this conversation into place, and I was in conversation with both of you, the reason why I got both of you together was that both of you come from two different worlds. Nayana, you're in a world which is more of the inclusion, and you're working with children at Bethany there, which it believes in that. And Vasudha, Dr. Vasudha, you're with an environment which you specially created for children who need that special attention. So tell me, Nayana, what do you think is the need for those children? Is it an inclusive environment, or is a special environment? What is the need?
So I'll talk about the children which are in my department. So we have children with mild to moderate learning difficulties, and it could be some other medical issues, could be epilepsy or similar. So for these children, again, as Dr. Vasudha is saying, learning difficulties may exist despite having normal IQ. So what LEAP created when in the program where I'm working is basically we work in smaller groups. So one is to maximum 6 children. And so that way the educator is able to cater to the individual learning needs. So, and these students can interact more, and they have enough time for their doubt clearances. Secondly, what we do is we do a lot of curriculum adaptation at the child level. So, these are just a few things which these children benefit. So, to answer your question, what do they need? So, they need, I feel they need lot of understanding and lot of patience and someone to listen to, and then handhold them in covering the curriculum requirements. So that is the need for students with mild to moderate difficulties. Now, special needs are different. I mean, they need altogether different approach where the academic milestones will have to be kind of adjusted to their capabilities.
No, but what I wanted to also know was that you're working in an inclusive environment. So you
Mhm.
have children who have special needs
Mhm.
working with the regular mainstream students, right,
Yes,
in the
yes.
same classroom. So how do you, how do you think that works? Does it work better for children who need that
Mhm.
special attention, or do they need a special environment for them to grow better?
So, no doubt, inclusion is the need. So, the kind of setup that we have, that's an integrated setup where academics is done with us, with the special educator, and they do get to interact and participate in the school-wide activities. So, I am a staunch believer that everyone benefits by inclusion, not only the children who have different needs, but all the adults and children who are observing that such a challenge is present. So, to answer your question, definitely this is what is required and it is beneficial for the whole environment, I would say for the whole society. So, inclusion is beneficial, definitely.
How about you, Dr. Vasudha? Like,
So,
what do you
the same
feel about?
question, yeah.
Yes.
So of the disabilities, I think to some extent, children with learning disabilities are at a slight disadvantage because they often get branded as lazy, unmotivated, because in everything else, they're so bright. Their
Mhm.
IQ is bright, they process fast, they're interested in so many things, they're artistic, they play games, they are very, very smart and then mischievous, everything. But when it comes to reading and, or math or something, they are extremely, they're not performers. So very often they get labeled. First point, and they get labeled and they get really abused. Parents beat them up, parents give them punishment for not studying, for not being motivated, because your primary currency in childhood is marks and studies, sadly. So
Sadly.
right there is this difficulty. Now this lack of empathy extends to schools. Only very recently, even now, we find schools and teachers very insensitive to uh, any learning problem. They always call them backbenchers, or the talk in the staff room doesn't have any empathy or any kindness or compassion when it comes to children with difficulties. They are just like, okay, this child I have to deal with. So this is the reality. Okay, and also awareness is not all pervasive. There are the tier 1 schools and maybe some of the tier 2 schools who have awareness, but a lot of teachers and not even the administrators don't have awareness of this. This being the case, I have personally seen children who come to our school and they say they like studies. What they say, what they show is very different from their experience. They don't like to say, I don't like studies. Yeah, I like to. You go to school, you like school? Is it difficult? No, I like. So this is how they talk. But I know, I never forget the story of this child in our school, and it's been many years since he left and he's grown up. He said his teachers paraded him with the single digit marks. They stuck it on his back and his front, and they paraded him in the school because they wanted to teach him a lesson. Again, coming from the paradigm that he's not motivated. Okay, these are the cruelties that have happened. Now, of course, inclusion is a right, is a basic right of every child. But how inclusion? Yeah, how do you do this inclusion is the crux of the matter. Are we all on the same page? Are we all trained? Do we go from, does this whole belief in inclusion, how it's to be done, percolated from the administrator right down to the custodial staff, up to the bus driver? So these are the pivotal questions that we have to ask ourselves. Yes, if you have to do inclusion, do it right. Do not let the child stand out like a sore thumb in the midst of an inclusive environment, which is far worse. It only reinforces the fact that he's not like everybody else, that his self-esteem is severely kicked around. So this is my point. While I am very pro-inclusion, I do not wish to romanticize that concept. And if you are going to do inclusion, please do it with a complete sensitivity and train every member of that school system to receive these children who have differences. Having said that, second, is there a role of special schools in this whole learning disability spectrum? Yes. If a child is able to go to an inclusive, receiving, empathetic school and also get services in a special school, that is the ideal combination. If he can get remedial help for his specific problems, can also get help in how to do his homework so that he can go to school and not be embarrassed, and also have a holistic approach through movement, art, and other activities so that his entire skill set is enhanced and lifted up for his future development, and get his OT. So this combination would be ideal. If a regular school is able to provide these services within its premises, well and good. But I don't know about Bethany, but I've not come across too many schools who are able to invest or who are able to do that in an ideal manner. But I have come across many situations where the child goes for remedial intervention, some OT, some joy therapy that we call joy therapy in another setup, and combine these two experiences, then his regular school experience becomes much better. Also, second part, if he's able to stay in a special school for some years and get all the scaffolding that he needs, and then goes into an inclusive environment, that also helps. So,
yes. So there somewhere, like if he has been in a special environment and he gets his confidence and his morale up, and he realizes what other strengths he's got, because he's always been pointed out, that this is the lacking, right? And that becomes so overpowering in his mind that the child doesn't identify his other strengths, whereas there are so many other strengths inside that child. So if he's in an environment where those strengths are being, the focus, and I think that would probably give him confidence. And like you said, and then move to an inclusion, like Nayana said, I think a combination of both would really work wonders for the child.
Yeah. And may I add, go ahead, please.
Give one example. Dr. Vasudha has said that if a child can get all the required support and be part of a school. So I'll just give an example that in Bethany, one of our students who was with my department, he participated in the Bethany musical and he became a star. Every 2 years, Bethany conducts a musical and it's pretty famous. It's done at a very large scale. So what Dr. Vasudha was saying, that give a holistic experience, allow the child to get exposure, get training, participate with other children in everything that the child can participate and wants to participate. So that is the idea that Bethany, we are trying, we believe in it. So when Dr. Vasudha said that will be good, so just wanted to share that it is possible because it's happening in Bethany here. So children do participate in all the activities and they are picked up on their strength. So, and I just want to bring out one more thing. When we say inclusion, it is also inclusion of all the students who come from different backgrounds. So, so it's not only the learning difficulties, it is also could be first generation English speakers, it could be economically challenged. So, and while in urban settings, we do not see girls being excluded, but it is very much existing in lower categories. And I have seen examples that in a construction laborer's family, the girl would be at home and the boy would go to a school. So I had gone and asked, how come they are of the same age? And you have selected the boy to go to school, because during the day I wouldn't see the boy. So I went and asked, she said he goes to school and she helps me. So inclusion is also of this kind. So that's the ideal definition of inclusion, is what I want to say.
Absolutely. So,
So just want to add something, Sapna, if I might.
please go ahead.
So we do a course, a modular course on training regular schools for inclusion. Okay. In this, what we have an approach which seems to have worked, because addressing the fear. So we do a step-by-step approach, doing talking to the administrative staff, the principals, all of them, giving them awareness, giving simulated activities, all of that. Then we talk to the regular school parents, because they are the ones who think this is contagious, you know. So therefore we have to talk to regular parents and say that, you know, if you're going to have children who have differences, we will be adapting the curriculum, modifying and accommodating, and then telling the regular children, having a meeting with them and saying that some, just like our fingers are different, and we have several activities for that, and saying there are some of us who will be different, and then for us to make this whole experience beautiful, and they add variety to our lives, and then talking to the parents of the children who have learning problems and the children themselves, because each, and the custodial staff, everybody gets, if a school is getting ready for inclusion, inputs have to go to all these groups so that they are ready to receive this. And so we conduct a program advising schools on how to go about inclusion that will be effective.
I think that's a beautiful, I think a beautiful program to, I think all schools should follow that, because nothing like accepting everybody the way they are, because that's the most beautiful creation that is there, right?
Yes.
So when we talk about this, both of you stressed on, different experiences with children. So when children are detected, or diagnosed on a disorder, I'm sure that the child understands and also goes through a lot of, a social, emotional, and even some mental, needs that he needs at that time, the support for all of that also. So how can, families or educators give him that kind of an environment? What all can we provide for him to, not get so affected by those kind of experiences that he has?
So I'll go
So,
first, Dr.
yes.
Vasudha.
Yes, please. Yes.
So I've, since I started working with children, so what I always felt was that the mother is the most important source of energy. She's the first responder and the person who gets the most flack for everything. You know, I mean, even if a child gets glasses, the mother is asked, "How come did you not feed the child correctly?" So yes, the child goes through a lot, but the mother is the person who understands it much before it comes out in the open. And what I feel is, we as a society, we as educators, we need to give that strength to the person who can make a difference. If we empower the mother, give her all the support, just listen to the mother and handheld her during those difficult days, and she will need support forever. I mean, she always will face, whenever the milestone is not met, then the challenge is there. You know, it's not that diagnosis is out and then we accept it and then it's over. No, it doesn't happen like that. So I feel, one, the mother has to be given all the support, and needs to be made aware of her strengths, that we can do as educators.
Yeah. How about you, Dr. Vasudha? What do you have to?
The question is about the setting for what kind of environment?
No, what I meant, yes, of course, the setting, the environment, because all of what the child goes through definitely affects the child's, entire being, and his social, emotional, and his mental health is definitely being, touched upon. So how can we make sure that, he gets an environment which helps him and not let that affect him much?
Yeah, very important. Nurturing environment is what is very important. Also, to keep showing children success experiences, because they have their share of not successful experiences when it comes to academics. So we have to have a very balanced curriculum for them, in which they have many avenues for success so that their self-confidence doesn't take a beating. Um, so in a school, so this kind of preparation definitely gives you a nurturing environment. Let's talk about home. There are homes which are academically very focused, and they put, especially in the South, you find a lot of very marks oriented thinking and things. I do come across a lot of that, and even schools which are very marks oriented. Now, if the home can just ease up a little, and like the Tare Zameen Par was a beautiful demonstration of that whole thing. The parents can be educated and said that it's okay. The marks and this does not determine who is going to be. There's a lot of lateral thinking and so much more to him than that. If the home environment can be chilled, children with any disability they absorb stress like anything, whether it's autism, whether it's learning problems, attention. Stress is what makes them very anxious and underperformers. This goes for you and me.
Yes,
If
of course.
somebody is breathing down my neck here, I really won't be able to talk, and somebody's observing me, I'll be like, oh God, what's happening here? So that's why we're all afraid of tests. We don't perform well under anxiety and stress. So if we can just chill and have a certain experience for the child, which is, yes, you have a little difficulty in school, but it's also our fault that school is so important. I'm sure you would do much better if there wasn't thing. So if we can give a children environment, non-judgmental environment, non-reactive environment. Suppose the child comes up with the test result, which is in single digit. And if the mother can say, oh, but you did all this right. I like your handwriting. Look for something to say a nice thing about. And then say, okay, this is a little bit of a problem with this. Let's see what we can do. And there's always a next time and a next time and a next time. Life is full of chances. Second chances, third chances, 25th chances. So to just chill, home environment has to be like that. And if some neighbor or relative comes and asks, how come you didn't pass in all the subjects? For the mother to put her hand around the shoulder of the child and say that, you know what, that's not even important. Have you seen him draw? To just quickly bring him out and say, have you ever seen him bake a cake with me? My God, he's amazing. To just completely move and make the child feel very supported. That's very important. In school, to have his classmates understand this child is struggling with something. So therefore, tell his neighbors and best friends, please help him at every juncture. Reduce a competitive environment in the classroom and say, support, working in teams is far more effective than working against one another. And to have his neighbor saying always when he has a problem, you are his friend, classroom helper or something like that, and give a nice designation and have helpers for him. And when you form cooperative groups, put him with a group that is sensitive, and so on. So you create a very nurturing environment and always have a variety of activities. Like in Waldorf education, they have sculpting, they have carpentry, they have a lot of artistic activities, dance, and the child will excel in most of them. And copper rod activities, a lot of, so to include the child in many of these, like Nayana was saying, the music, to make sure he has a share of success stories. I would say that's very important in no matter what setting you're going to put the child in.
Absolutely. And I think that's where somewhere that multimodal teaching really needs to come in as a universal teaching, platform.
Method.
I
Yes.
think that will help every child express freely without being judged, because everybody cannot be the same in math. Everybody, and why? I think everybody has their own skills, everybody has their own talents, and they need their own time to shine. So I think it's imperative that we as educators, I think, create that environment in schools where children can, express freely whatever their skills are, and we can, move them up from there on, and not just because we have a ladder that we want them to climb. So
Yes.
they can, explore things on their own.
Yeah, that famous cartoon, Sapna, I was trying to search for it. Maybe we can find it later. In which, if you ask a fish to swim and a bird to, you must have seen that cartoon, right? Um Asking a fish to fly and a bird to swim and this to happen, that to happen, how will they shine? It's something like that. Whatever comes naturally to the child, let him exhibit that
Yeah.
organically. And then, we also expect from him to grow in other areas. Yes.
Absolutely. And
I'll try
I
to
was,
send you that cartoon. Yeah.
please do. And in fact, I
Yeah.
was listening to a person the other day, and he's about now 20 years or something. And he was talking that, he was diagnosed at ADHD, right? And he said the moment I got that tag, the moment I got that, I was like, if the teachers looked at me differently, my friends started looking at me differently, and there were times when I had things like this in my mind. It was just that I couldn't write it down as fast because I was ahead of my class at times. My peers were still trying to learn it, and I would have grasped that concept, but it was just that I could not put it on paper. And that became so much bigger. And slowly he talked about how a teacher helped him realize that this was a strength, and that was a small weakness that was there, but this was the bigger strength that he needed to focus on. So I think that's all about it, that we need to shine the light on the other strengths that the child has in him.
Yeah. So one set of videos, have you heard of this, Sapna? Richard Lavoie's Fat City, How Difficult Can This Be? Have you watched it? It's not very new, it's old. This sensitizes you very effectively to the whole learning disability topic. It's called Fat City video, and it's called How Difficult Can This Be? So he has, it's based on simulation. He has his room full of very highly achieving people, and he puts them through one activity and the other, and he's just like a school teacher could be. And for them, it just blows their mind, And if this video alone can be shown to teachers and to parents, they'll get it. They just get it.
So Nayana, coming to you, in your school, do you like when you are talking about an inclusive environment, so your children from the mainstream, do they go through some process like that where they are taught to be more empathetic towards children who are needing a little support?
The thing here is, I mean, in Bethany, the culture is quite open. The management, starting from the management and coming down to the support staff. So it's been a culture in Bethany to really embrace inclusion. Bethany was founded on a story of Mrs. Minon David. So she lost her two sons, and Bethany institutions came into being. So, well, not specifically that we have to, but what I have noticed is, because it has been a tradition here, it also children are very, very accepting. So if you leave the children alone, I mean, things should happen automatically. I feel it's the adults who bring in their biases, and then it all gets disturbed. So I've seen very good friendships forming, and they are such source of strength for each other, and they help each other. They're very sensitive about each other's different challenges. So, they pitch in where it is required. So, I mean, I feel it's the culture which is the biggest teacher, biggest curriculum here, that it should work. I mean, we adults have to tone down a bit in our influence on the children.
So in fact, Nayana, you are working a lot with children on ADHD, right?
Yes.
So tell us a little bit about that. How easy or how difficult is it to detect children on ADHD?
Well, it is, as Dr. Vasudha would say, the milestone would start giving indicators early on, and the milestones are pretty saturated in the early years. But it becomes quite obvious when the academics becomes. I mean, it's a big thing when it's in 6th and 7th. If you come to those grades, then it becomes very obvious that the child is struggling. So it is obvious children with ADHD primarily do not like to write, and there the struggle becomes so big when the curriculum is running and galloping fast, and here the writing challenges take over. So it is obvious. It becomes very clear that the challenge is here. Ask the child orally, and like that it will come out. The memory is excellent, presentation skills are amazing, communication, language, confidence, everything is in place. But get the child to put down in the notebook, that's an absolute no-no. So there are ways how we support such a child, when everything else is going good and the challenge is in one particular area. So, I mean, we give some accommodations and of course support the child and understand that this is one area where he doesn't want to do, he cannot do. So, yeah, so there are ways to work around the situation.
Right, right. So, do children who are on ADHD also encounter some learning disorders also? Because
Yeah, so they do, because most of the times one challenge is accompanied with the other. And if you see the percentage of children with learning difficulties and ADHD is higher, most of the children have at least two. And third angle to the situation is come to the teenage, and then the socio-emotional element also kicks in. So it becomes very difficult, and I mean, friendships are being formed. Sometimes friendships are not being formed, and then there is social exclusion. It's all unintended, but I mean, when the communication doesn't happen, then it just doesn't gel enough. So that is the age where host of other problems come out. um, Sleep disorders, anxiety, low self-esteem, anger management issues, along with ADHD, and could be dyslexia. It could be so many things coming out at the same time.
correct. And apparently, like there are pharma therapies also
Yes.
for the disorder, but I think generally people prefer the alternative interventions more than the medication. Is that true? Is that what it is like?
I mean, I wouldn't go into the medical part of it, but yes, what you're saying is correct. There are options available, and there is resistance amongst parents, and each side has its own justification. But yes, I mean, it's between the psychiatrist and the parents who have to come to a conclusion that this is how it's going to be, and what is the benefit of going the medication way.
And you do have, I mean, a lot of alternative interventions. You have the body based
Yes,
activities that you would
yes,
make the
yes,
children go through, yoga, physical training, and you have the
absolutely.
cognitive behavior therapy. And
Yes.
I think there is so much that you work with, right? The play therapy.
Yes, yes, there's so much. So again, then that's where the mother's role comes into play. I mean, there is so much that one person can do and should do. And you would see that many special educators are first mothers of special needs children. I mean, that's where their journey starts. They equip themselves to help their own child, and that's where it begins. I know so many of my colleagues who have come into this field out of need. And what could be better than that? Because a mother can do so much, because those school hours are very short, and so much can be done outside school hours. And that's where, if the action is good, it will benefit in the school hours. So there are so many things, and you need support round the clock, 24 by 7. If you're taking effort, there's diet, there's exercise, meditation, yoga, play, sports, so much, sleep management, and then support of the family. All these things make a huge difference, and it has to be continuous. Day in, day out, it has to be. Then organizational skills have to be worked upon, and life skills have to be imparted. So I mean, that it is a lot of work. It is a lot of work, and it is possible. It is
Absolutely.
possible to make a difference. So,
Absolutely. Dr. Vasudha, would you want to add something to it?
Yeah. When you talk about attention deficit disorder, uh, it is, if you visualize, somebody is bursting out of their soul. So they can't be contained. You're trying to take somebody who's like bursting and then trying to fit them into some tight clothes. It's like this. That is the whole experience of the child. Like he's just bursting, but we are putting him into tight clothes. That's it. The other model of looking into this understanding ADD, ADHD versus a normal processing is this laser beam attention model. I don't know, can you see this? So this is the normal attention paradigm. this one, in which suppose there's a circle, we have a foreground and a background. Let me just explain it. Yeah. So all our learning happens from the foreground. Okay. And the background is there. Like I have something happening, but this is my foreground. For a child with attention deficit disorder, apparently everything becomes a foreground. So if there is a bird chirping outside in the tree, then that becomes his foreground. And then he keeps shifting from one foreground to the other, which then comes in the way of his absorbing too much from any one foreground. So the shifting foreground. So that is one way people look at attention deficit disorder. And sometimes this very shifting of foregrounds can become the cause of the learning difficulties. One. Secondly, also, if there's a lot of coordination problems, motor problems, which again results in lack of coordination, eye-hand coordination, hearing and hearing, eye-hand, all coordination, all of those result in learning problems. So a classroom setup for a child with attention deficit disorder has to keep all these traits in mind. So the number of visuals in the class, how you present the subject, how do you give him, like when you ask him to read, to cover rest of the lesson, keep shifting the shield and then filtering and things like that. There are many strategies to get this attention deficit child to focus, but definitely a lot of this OT, a lot of massages, a lot of wrapping him up in heavy blankets, those many strategies are there which help attention deficit disorder. But I think sometimes it's a lifelong disorder. And this ADD and ADHD, there's a lot of difference. Some children who have attention deficit disorder, but not their hyperactivity, and they go undetected. And within their heads, it's shifting and all, but because you're sitting in one place and not hyperactive, for us to understand this is what is going on with them becomes difficult. But their learning also, difficulty comes from a certain lack of being in that space. So there is a diagnostic. So just many parents come and tell you, "Romba hyper, he's very hyper, madam." That's what they tell you. That is not actually ADD. You have to go through a clinical test in order to determine, because it is definitely a neurochemical disorder in which there is a chemical imbalance. So therefore, going through the test, going for impulsivity, reflexes, all of those things, and then coming out with a clear diagnosis of attention deficit disorder is very, very important, so that you can structure instruction. And as far as medication goes, in the US, this became a political debate about giving medication to children who are even slightly restless and making your lives easier. This is a huge controversy. Here, they have a medicine called Attentrol, which doctors do prescribe. And it comes, if you give it for some 8 years, have some stunting effect. There are some side effects to these medicines. But as long as the child is on medication, but it's not a lifelong change. So even if you're giving medicine, to supplement it with enough therapeutic measures, to very organic, not like therapy, but if you're doing movement, do it in the form of a dance. Don't do therapy as in therapy, but integrate it with an experiential thing. That makes it easier for children. So yes, of course, learning disabilities and ADD, this coexist many times. It's very common.
Somewhere I feel like we are talking about it, and it's so nice to hear your views, both of you, and I'm learning so much here. And I just think that, when teachers in the mainstream school, we do have a little bit of the special education program in B.Ed, but it is so minuscule compared to when it comes for a teacher come face to face with a child who needs help, right? And for that teacher to understand what kind of help that child needs and what is going to be good for him, what should I do so that I can help him best. Don't you think we are at a point where our teacher training needs to be upgraded and incorporate more of the special education, make it mandatory somewhere, so that, we are able to help the child, in a better way?
Without doubt, there is no doubt. Going forward, I feel it's only going to get better, because the awareness is definitely increasing. Whether it's increasing enough or not, we can leave that aside. But going forward, if you see awareness is on the rise, and teacher training is the way to bring in some form of inclusion. First is to educate the teacher, as I would say, educate the mother. So, the main people in both the environments are aware and equipped to go forward, in the right way.
No, what I meant was like it should become like a mandatory. Like if you're qualified as a teacher, you need to have this much of at least
Yeah.
the basic special education knowledge for you to be a
Oh,
teacher.
yeah,
So
definitely.
then, go ahead. Sorry.
No, go ahead. I'm done. I'm done.
So the new education policy is very encouraging. They have made teacher training a 4-year professional course.
Correct.
So if that comes in, then this whatever you're talking about will definitely happen. And anything you read about special education doesn't prepare you actually to work with children. You need to have that hands-on and that internship in order for it to. So if you they must make it at least a year-long inclusion in their B.Ed program. It's not enough, like you say, what they're doing. Or they should make it mandatory. Every school should necessitate that every teacher goes in for a training. If the B.Ed doesn't have it, then at least the school should insist or have in-school training programs uh, for this whole thing. So very basic, like what a child needs as learning requirements, that also teachers don't know. And Sapna, one thing I feel so strongly is every teacher should know and parents should know about the stages of child development. What happens to a child at every stage of his development and what should be done at every stage, whether it's physically, neurologically, emotionally, psychologically. If this has to be like a chart hanging in your home everywhere, so that you know what to teach, you know what to expect, and you're not running away with it. If this knowledge is not there, you're always going to be confused about what to teach and what is not there. And I would strongly recommend Waldorf education because it comes up with these lower senses, middle senses, and higher senses, and drives home the importance of the development of rhythm, of the life force, of sense of balance, sense of touch, all of these, and the impact on all kinds of development, and it lasts throughout your life. So this knowledge is very, I think, crucial to all teaching programs.
Absolutely. I think it's been so insightful, and I mean, I've really enjoyed our conversation. I've learned so much, and I'm sure our viewers also have learned a lot. Before we leave, any few words for our viewers, Nayana, how about you? Just a
Yeah.
message to everyone.
Just a message. My whole focus is on the mother all the time, and I want to just say that the mothers should be empowered and given all the support, and work with hope always. I mean, we always need to have hope. And there's a person in there. There's a child. It's not only academics, and the child is a gift of nature. It's a gift of God. So it's perfect. So I mean, just accept. That's the message. Simple message.
Thanks.
Yeah.
How about you, Vasudha?
Yeah. So my message may be slightly technical, if that's all right.
Please go
So
ahead.
in
Yes.
order for us to understand when a child has a learning problem, or you want to prepare a child for schooling and you see certain lags, a few points that they can focus on. One, spatial orientation, how your body, the directionality, all of that. Laterality, the both sides of the brain, using that. Dominance, establish clearly whether the child is right-handed or left-handed, sooner than later, by 3 perhaps. Doing a lot of midline barrier crossing activities, which means across, front and back, top and bottom, having a lot of those activities so the child can physically develop. Rhythm, having a proper rhythm to the day, for as long as possible. Eating hours should be fixed, sleeping hours, everything should be fixed. So the child has this coordination is intact for the child. And also having rhythmic activities in the school and at home. Just clapping activities, rhythm, stepping activities, stomping activities. Those are very important. To have direction and goal as part of your whole curriculum. And to make sure that the child can understand 3D versus 2D processing. So these are a few points that a teacher should remember. And to incorporate into the curriculum so that it's a pre-referral intervention for learning disabilities. And also there are very good programs called Extra Lesson, Take Time. These programs, if the teachers can go and prepare themselves, it very seamlessly, they can integrate this into their classroom teaching. So it applies to all the children in the classroom. So
Beautiful. I mean, I could just sit there and just listen to the two of you. And I wish we could just go on, but maybe we'll do it another time. We'll get you back in and, get your experiences here. And in the end, I really want to thank you both for taking time out and to share this knowledge with us. And all I can just say and add to what you all contributed is that I think that disorder, what we call, is just a small part of the entire child's personality.
yes.
There is so much more within that child that we need to focus on. And if we keep focusing on those trends, I'm sure we are going to create a better world for those children also.
Yes, certainly. Kindness is very important. Yes.
Absolutely. Thank you
Thank
so
you.
much.
It was an absolute pleasure, and I hope people are benefited by this
I'm
interaction.
hopeful too. And let's keep this going. And thank you so much once again.
Nice meeting you, Nayana. Thank you.
Thank you, Dr. Vasudha. Thank
Yeah.
you so much for having me. Thank you.
Bye.
Thank
Bye.
you, Nayana.
Bye.
Bye.
Bye.